everyone, welcome to yet another role play card discussion from Teachers Academy, and this is Aishwarya, and today I have Varsha here. And for today's role play discussion, we have chosen a topic that is frequently asked in examination, that is mother and child scenario. And why we took this particular role play for today's discussion, everyone is having the confusion whether we need to ask the name of the bystander, that is the mother, or the patient, that is the child. So for that, we will have to understand whether it is a non-case or an unknown case. So let's see the scenario of this particular role play.
Sure. So the setting given here is a mental health clinic, and the scenario, it's been mentioned that a parent who visited the clinic with the concern of his or her 14-year daughter has social withdrawal, hopelessness, depression, loneliness. And it's been mentioned that the daughter is not present for the discussion.
Exactly. So from this particular scenario, we can understand that this is going to be an unknown case. So we need to proceed with the name of the bystander, that is mother, for the communication purpose, followed by the child for the documentation purpose. Then what about if it is a non-case situation, Varsha?
Yes, so when it's a known case, definitely the child will be our patient. So we'll be asking the child's name during the preparation time, and soon after that we'll go with the mother's name or the bystander's name during the time of conversation. So this is how we need to approach a mother and child situation in two different contexts, be it an unknown case or a known case. So we hope you got an idea about this. So now let's start the role play.
Yeah, sure. Good morning.
Good morning.
Please be seated.
Thank you.
And my name is Aishwarya. I'm a nurse working here in this facility. And by looking at your face, I can see that you are really worried about something. So could you please tell me the reason behind that?
Yes, nurse. Actually, I'm concerned about my child. I feel like she is socially withdrawn. She's not at all interested in any sort of activities. So that is a cause of concern for me.
Oh, that's so sorry to hear. And your situation is completely understandable. But you don't need to worry. We will take care of your child. But before proceeding further, could you please tell me your name for the communication purpose?
Sure, you can call me Varsha.
Yeah, Miss Varsha. See, from your words, I can sense that you're really worried about your child's situation. But you don't need to worry. Your child is in our safe hand, and there are a lot of treatment options available for that. But before proceeding further, for the proper documentation, could you please tell me the name of your child and age as well?
Yes, so her name is Hanna and she's 14.
Okay, thank you for sharing that. And for the better understanding of the scenario, could you please tell me when this condition has exactly started?
It's been 2 weeks as of now.
Alright, so what about her general health? Is she behaving well?
Yes, she's perfectly alright other than this thing.
Okay, so what about the social habit of your child?
She's not having any sort of social habits.
Alright, so have you noticed any signs and symptoms in your child?
Yes, exactly. I noticed a lot of symptoms in her case, to mention hopelessness, depression, fatigue, anxiety and mood swings. And I'm quite concerned about this thing, nurse. I don't know what is my child's condition and what might be the likely cause of this.
Yes, Ms. Varsha, being a mother, I can totally understand your situation, and your concerns are also very much reasonable. But you don't need to worry, we will definitely take care of your child with the best proper treatment. And based on the information that we have gathered from you, we can say that your child may have seasonal affective disorder. But by hearing this name, you don't need to worry, I'll explain everything in detail. This is a kind of type of depression, I would say, which is related to changes in season, and it is affecting the child only for a short period of time. That's a very positive thing, is that right?
Yes, I'm glad to hear that, nurse.
Yes, that's really great. And when it comes to the causes of this particular condition, it may occur to the patient, maybe due to vitamin D deficiency. Maybe the reason behind that is your child may getting lack of sunlight exposure and maybe having kind of negative thoughts as well. So is it clear so far?
Yeah, I'm getting your words, nurse, but I just need to ask you, is there any treatment options available?
Yes, Varsha, that's a very reasonable question came from your side, and you don't need to worry at all because there are a lot of treatment available for your child's situation, starting with phototherapy or light therapy, where we are using bright light and UV light for the treatment purpose. Moreover, you can go with psychotherapy, which will help to identify the emotion, thoughts and behavior of your child. In addition to that, we can also go with antidepressant medication, which will increase the neurotransmitter and thereby boosting the mood and emotion of your child. So is that clear to you?
Yes, nurse, I got an idea now.
Yeah.
But at this point, I just need to ask you, what are the after effects?
Yes, Varsha, I can totally understand that this situation is completely overwhelming for you. But you don't need to worry at all because, as I mentioned earlier, this is going to be for a very short period. As the season changes and with proper treatment, your child will be completely alright. And since you asked me about the side effects, I just wanted to tell you yes, there are positive and negatives for everything. And when it comes to this treatment option, your child may be having oversleeping, appetite changes such as craving for various food, along with that weight gain, tiredness, and sluggishness may also be noted with your child. But you don't need to worry, all these are the associated symptoms of this treatment, and everything will be alright with your child as days goes by.
Yes, I got an idea now, but I'm concerned.
Yes, I can totally understand, but with proper treatment and with proper guidance, everything will be alright. And for that, it is very important for you to make your child understand about the situation. Then only we can take her for proper appointment and start with the treatment. Will you be able to do that?
Sure, nurse, definitely I'll talk to her about this and make an appointment as soon as possible.
That's really great to hear, Varsha. So please don't hesitate to ask if you are concerned about anything. Everything will be alright with your child, and we wish your child a speedy recovery.
Thank you.